Hi everyone, this is Jesse Sherrod with NationalSeniorAdvisors.com. Thank you for tuning in to our video today on the difference between Medicare Advantage, Medicare Supplement, and prescription drug coverage. So, one of the most frequent questions we're asked is, what's a Medicare Advantage plan, or what's a Medicare Supplement plan? What's prescription drug coverage? Well, let's start with the difference between Medicare Advantage and Medicare Supplement. Both of these plans are offered by private insurance companies. They fill in the gaps of original Medicare, and you must be enrolled in original Medicare in order to obtain one of these plans. If you look at the chart here, you can see that most people choose traditional Medicare, which is Medicare Supplement, versus Medicare Advantage. That's because Medicare Advantage plans are fairly new, and at the same time, Medicare Supplement plans and original Medicare offer more flexibility in the types of doctors you can go to, and they're easier to predict your medical expenses and budget your medical expenses through the whole year as compared to a Medicare Advantage plan. And when you talk to one of our senior advisors over here at NationalSeniorAdvisors.com, they can show you the different ways you can budget your medical expenses and estimate what you're going to end up spending. And especially if you're living on a fixed income, Social Security, retirement, it's very important to have a very clear idea of what you're exposed to. And it's just easier to figure that out on a Medicare Supplement plan. Now, let's look at Medicare Advantage plans first. They're also known as Part C of Medicare. The pros of these plans: you have low or a no monthly premium. You have open enrollment. You can change the plan every year with no medical questions. They usually cover prescription drugs built into the plan, so you don't have to buy an extra prescription drug plan. And they come with free gym memberships. A lot of them come with dental, vision, hearing benefits, a lot of different unique perks that come with these plans. It's pretty cool. And now let's talk about the cons. Usually you're having higher out-of-pocket costs. You have higher co-pays, co-insurance on these plans. The networks are limited, so you cannot see the same types of doctors and hospitals that you can on a Medicare Supplement plan, but that's okay. You have to see the doctors and hospitals that are part of that plan's network. It's like a limited network that you can usually utilize. Now, you're typically locked into these plans. You have your opportunity to change every year, but once you make that decision, you can't change during the middle of the year. You have to wait until the next open enrollment period. And up to $6,700 a year is what you could end up spending out of your pocket for a Medicare Advantage plan. Now let's talk about the supplement plans. The pros on these plans: lower out-of-pocket costs. The plans are standardized, so no plan can be different. It's very easy to understand. A Plan G is the same as a Plan G, whether you go with Aetna, Anthem, Cigna, United Healthcare. They're all the same. It's just the premium's different, and the company that's offering it has different experience in the market. So the plans also have lower co-pays, no out-of-pocket costs, no co-insurance. The networks are not limited. You can go to anyone that accepts original Medicare on a Medicare Supplement plan. You are not locked into these plans, and it's a lot easier to budget your healthcare expenses. So again, if you're on a fixed income, you can accurately predict exactly what you're going to spend for the whole year on your medical expenses on these plans. There's no surprises. The monthly premium is a con. It's usually a bit more expensive than a Medicare Advantage plan. You don't really get the perks like the dental, vision, hearing, gym memberships, etc. Part D prescription drug coverage is not included, so you have to buy an extra standalone prescription drug plan, and you have one chance to enroll in these plans without medical questions. So after you go past your initial enrollment period with a Medicare Supplement plan, you can usually not change into another Medicare Supplement plan without medical questions. There are a few exceptions to this rule in a few states, and also if you have a special enrollment period or a guaranteed issue window, we can certainly help you determine if you have one of those. For example, if you want to switch from your Advantage to your Supplement plan, we can help you figure out if you can do that. If you want to switch from your current supplement plan to a lower costing supplement plan, we can certainly help you figure out if you're able to do so. But what we usually recommend to our clients is, if you can afford a supplement plan, you should definitely enroll in one, because it's very easy to leave your supplement plan and enroll in a Medicare Advantage plan, since those plans have a yearly open enrollment and you can get one anytime, no matter what your health history is. But if you go the other way around and you choose a Medicare Advantage plan first, sometimes you're not able to enroll in a supplement plan no matter how bad you want one. So we always say, if you can, go with the supplement plan first. It gives you better coverage. You know, you're going to want it if you're in that worst case situation. You're going to have the most options available, but there's nothing wrong with the Medicare Advantage plan. Both plans, in our opinion, are much better than just having original Medicare. So let's talk about the different enrollment periods. Medicare supplement plans have what's called initial enrollment, underwriting, and guaranteed issue. So the initial enrollment period starts ticking the moment your Part B is effective, and it starts 6 months after your Part B effective month. So if your Part B becomes effective on January 1st, you have 6 months for your initial enrollment period, and after that 6 months is over, you will never have another initial enrollment period in your life. And it's important to understand this, because it's your one time to get into a plan without any medical questions. And once that's over and you want to switch plans, you have to go through underwriting and you have to answer the medical questions, which a lot of times isn't a big deal. The medical questions are fairly simple. We switch people's plans all the time because they're able to save money by doing so. There's new things happening in the market where it makes a lot of sense to switch. For example, switching from a Plan F to a Plan G makes a lot of sense right now due to various market factors. But you know, if you get in a situation where you have a medical issue, you may get locked into your plan and you're not going to be able to answer the underwriting questions, so you're going to be stuck with your Medicare supplement plan. And your only other option would be Medicare Advantage, but if you wanted to change your Medicare supplement, you just simply would not be able to. So it's very important to choose a high-rated company with a lot of experience and a history of low rate increases, so you know you can afford the plan in the future when you probably will need it the most. And the guaranteed issue enrollment period is for people who change states. If you move to a new state, you can switch your Medicare supplement plan. And also in certain states, like there's 2 states, California and Oregon, you can actually change your Medicare supplement plan during your birthday month every year without medical questions. And those are the only 2 states that have that specific rule. But the guaranteed issue is kind of like a special enrollment period. Another reason for one would be if you happen to be on a Medicare Advantage plan and that plan leaves the service area, then you'd actually have the ability to enroll in a Medicare supplement plan at that time. So if you ever have questions about your enrollment periods, just let us know. We can let you know where you stand on that. Now, Medicare Advantage is the same type of it has the same type of enrollment periods as Medicare supplement, pretty much. You've got your initial coverage election period, you've got your annual election period, your disenrollment period, and your special enrollment. So initial coverage election is when you first become eligible for Medicare Part A and Part B. You have a 3-month window before that time, and then you have a 3-month window after it. Now, you can sign up 3 months before and the plan will take effect on your 65th birthday, or you can wait for 3 months. It'll take effect the following month. It's your first time you're eligible for Medicare, and it's your first opportunity to enroll. They let you sign up a little bit early, which is nice, and they also give you 3 months after you're first eligible to sign up, which is pretty nice as well. Besides that, you have an annual election period, so every year you're able to change your Medicare Advantage plan with no medical questions. So going back to what I was saying earlier, if you happen to enroll in a Medicare supplement plan and you no longer can afford the higher monthly premiums, you can always switch to Medicare Advantage. There's no risk whatsoever in switching to Medicare Advantage, because they're required to accept you no matter what your health history is. Looking the other direction, that's not the case. You cannot always switch from Medicare Advantage to Medicare Supplement. And again, that's why we recommend people go with the Medicare Supplement if they can afford to do so, because it's a little more expensive to have a Medicare Supplement plan. Now, you also have a disenrollment period where you're able to return to original Medicare or switch to a Medicare Supplement plan after the annual election period. If you do not take advantage of the disenrollment period, you're locked into the Medicare Advantage plan until the next year. Now, when I say switch from Medicare Advantage to Medicare Supplement, you can do that, but you may have to answer the medical questions if you're outside of your initial enrollment period or you don't have a guaranteed issue. And just like special enrollment in Medicare Supplement, you have them in Medicare Advantage as well. Certain situations allow you to leave a Medicare Advantage plan or change your Medicare Advantage plan outside of the specified time frames. The annual election period each year runs from October 15th till December 7th, and the disenrollment period runs from January 1st to February 14th. So outside of those time frames, if you want to make changes, you may have the ability to do so. Certainly you can give us a call or send us an email and we can let you know where you stand in that regard. Lastly, we want to talk about Part D. Part D is also known as prescription drug coverage. Now, there's basically three ways you can approach it. The first way, you can stay in original Medicare and just do nothing and not enroll in a Part D prescription drug plan, but we do not recommend that, because if you go 63 days without a Part D prescription drug plan when you're first eligible for one and you don't have credible coverage, then you're going to incur what's called the late enrollment penalty, and actually you're going to pay a lot more money for your Part D prescription drug coverage when you want to enroll in it later on down the road. Now, the second option would be to enroll in a Medicare Advantage plan with Part D prescription drug coverage built in. And the third option would be a Medicare Supplement plan with a Part D prescription drug standalone plan. Now, as you can see in the chart, some people pay a little bit more for their prescription drug coverage depending on their income, but most people will just pay the plan's premium. In some cases, you don't have a premium if it's part of the Medicare Advantage plan. But it's important to understand all these differences. We get these questions every single day. What's Medicare Advantage? What's Medicare Supplement? What's a Part D prescription drug plan? There's a lot more to it than what I've gone over in the video, and it's best to get linked up with one of our advisors to explain to you all your options and figure out what makes sense for you based on the doctors you see, your budget, the medications you're taking, and your very specific needs. Everyone's different, everyone's unique, and everyone deserves the attention of an advisor. There's no charge for our services. You can call us anytime, Monday through Friday, 8 a.m. to 5 p.m. And I encourage you to visit our website and send us an email, info@nationalsenioradvisors.com. Again, my name's Jesse Sherrod with nationalsenioradvisors.com. I hope you have a wonderful rest of the day, and thanks so much for watching our video.